Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. On the occasion today, we will discuss about conceptualization and treatment of kleptomania, behavioral using cognitive and behavioral strategy. Before continuing, let me introduce myself first. I'm Vera Espransa as the moderator, and the number of our group consists of 7 people. I will introduce my group members. First, there is Govinda Kinayungan Balkan, then Elina Jian Gemalasari, Fajar Saputra, Wilhelmus Dwi Hendrawan, Arny Virangga, and finally Rico Okto P. And the first discussion will be explained by Fajar Saputra.
Hey, my name is Fajar Saputra. Here I will discuss a little about the meaning of kleptomania and the background of kleptomania. Kleptomania is a serious disorder that affects a small person of the general population and a larger person of the clinical population. The DSM-4 American Psychological Association 2000 classifies kleptomania as an impulse control disorder in which the essential feature is a recurring failure to resist impulse to steal items. Criterion A, even though those items are not needed for personal use or their monetary value. Criterion B, the individual experience an increasing sense of tension just prior to the diff. Criterion C, and feel pressure, gratification, or relief when committing the diff. Criterion D, the stealing is not committed in order to express anger or vengeance, is not done in response to a delusion or hallucination. And criterion E is not better accounted for by conduct disorder, a manic episode, or antisocial personality disorder. And the next discussion will be continued by my friends. Thank you.
Next will be explained by Arny Virangga, who will discuss the prevalence and diagnosis. For Arny Virangga, please welcome.
Here I will explain about prevalence and diagnosis. Lots of research have researched the origin of this kleptomania and lots of statements from several research. Many research say that this kleptomania is a disorder. With respect to many of these other disorders, it is not clear if they are symptoms of this other disorder, separate but comorbid disorder or problem. What is clear, however, are the symptoms of kleptomania rarely occur in isolation and often coexist with other mental health problems. Additionally, there were higher rates of affective disorder and substance abuse in first-order families, individual members with kleptomania, and a report of social isolation, dysfunctional cognition, and high level of perceived stress were also associated with increased frequency and or intensity of kleptomania behavior. Thank you.
Next, we will discuss about the ontological and assessment model for Govinda.
Okay, thanks for the time. In this occasion, I will to tell you about the next presentation. This presentation is Behavioral and Cognitive Behavioral Etiological and Assessment Model. Behavioral and cognitive behavioral model of the etiology of kleptomania have largely supplanted psychoanalytic model and are generally complementary to biological model. For example, propose a psychobiological model of etiology that combine neurochemistry with behavioral theories of classical and operation conditioning. They posit that certain individuals become conditioned to reach to certain stimuli or cause or to crave or desire stealing because of the rewarding sensation that follow it but of with cause change in the brain. The next. In fact, a particular strength of the cognitive and behavioral model is the use of functional assessment, functional analysis, and operationally defined behavior that greatly reduce the need to rely on singular etiological model or specific diagnosis prior to beginning treatment. Okay, thank you.
Okay, then I will continue the explanation from my friends. A far more bold and daring stealing behavior may be shaped if reinforcement of the stealing behavior continue to occur in the absence of any type of punishing consequence. Eventually, individuals with kleptomania come to rely upon stealing as a way of coping with stressful situations, and distressing feelings which serve to further maintain or via positive and negative reinforcement the behavior and decrease the number of available alternative coping strategies. Okay, next will be followed it by Wilhelmus Dwi Hendrawan.
Okay, thank you for the opportunity. I will continue this question for my friends. So, research indicate that among survivor individuals who experience stable global feeling of shame, an example, I'm a bad person, are more likely to continue stealing. We reach those who experience situation-specific feelings of shame, an example, imagining getting caught stealing when one is an otherwise good person, are more likely to stop. Finally, subtension that may discourage motivation for change, including personality disorders, as an antisocial personality disorder should be identified and appropriately addressed. Thank you.
Then Elina Jian will discuss about behavioral and cognitive behavioral.
Okay, next, behavioral and cognitive behavioral treatment model. Although many of the disorders that co-occur with kleptomania behavior are frequently treated with medication, to date there have been no large-scale control treatment studies for kleptomania. Selective serotonin reuptake inhibitors, antiepileptic, and opioid antagonists have all been used to treat kleptomania with varying results. However, pharmacological interventions are frequently accompanied by side effects might find disagreeable, leading to poor compliance with the medication. A hallmark a hallmark of behavioral and cognitive behavioral intervention is the use of the scientific practitioner model and the systematic measurement of treatment progress, which albeit relies largely on self-report. Thank you. Next.
Okay, last will be followed by Rico Okto P.
Historically, kleptomania has been considered a disorder mainly seen in white, upper and upper middle class women. It is possible that the current criteria of kleptomania only capture a limited segment of the population, or e.g. upper middle class, with women and untouchably injured others that may opt suffering from kleptomania but instead are labeled as criminals or e.g. lower caste males. Therefore, we suggest that researchers continue to examine the characteristics of the diagnosis with kleptomania, while not constraining themselves to the current commonly accepted criteria, including kleptomania in future. Catchment or large population studies can help to provide more information about the disorder in as empirical, less self-selected manner. The ethnographic nature of behavioral intervention, combined with the normative nature of behavioral principles, makes behavioral and cognitive behavioral interventions equally advantageous for individuals struggling with kleptomania behaviors.
Well, this is the presentation of our group. As the moderator, I apologize if in the delivery of material there are so many mistakes and shortcomings. That's all and thank you. Wassalamualaikum warahmatullahi wabarakatuh.